Planned for chemo, and when they have started with the chemo cycle, they really need to focus on firstly protein rich meals. Okay, so they have to make sure that in every meal they have something or the other which is protein rich, so either dal or some paneer sabzi or some egg curry. So we have to see that there is some protein in every meal. Secondly, good fruits and vegetables, and if they are a non-vegetarian, they have to focus on egg, chicken and fish. So what we need to ask them to avoid in terms of food will be everything which is refined. Okay, so whether it is refined flour, which is maida, fruit juices again. A lot of patients will rely on fruit juices and thinking that it is more nutritious, but it is not. Why? Because it is refined. In the sense, when we are making a fruit juice, we use 2 to 3 fruits at a time. Then we strain out the fiber. The fiber is the one component which is actually beneficial. Other than that, the fruit juice is as good as a sugar water. So we have to kind of counsel them that fruits are better than fruit juices. Okay.
So another question that patients have is whether fruit juices are allowed or not.
So fruit juices is you think it as a refined food only. Why? Because when we are making a fruit juice, firstly we use 2 to 3 fruits at a time to make 1 glass of fruit, 1 glass of juice. Okay, and what we are doing is we are kind of straining out the beneficial fiber, which is very good for the gut, and what we get is kind of fructose water. So the sugar present in the fruit is fructose, so it is as good as a sugar drink. Okay, so that is what we need to counsel the patient, that they have to eat their fruits, not drink their fruits.
Another question that patients have, Pushpa, is what are some good sources of protein?
Okay, so let's start with vegetarian sources. So our dals and whole pulses. Whole pulses meaning your chole, rajma, whole sprouts like moong sprouts or matki sprouts. They can go with soybeans also, but a lot of patients are concerned about the estrogen present in, phytoestrogen present in it. So if there is kind of hormonal cancer, then at that time we actually take a call if we want to avoid it or not, but they can go ahead with soy products also. So another protein source on which the vegetarians can rely on is milk and milk products. So dahi, milk, paneer, these are very good sources of protein for vegetarians. Okay, now let's talk about non-vegetarian proteins is fish, eggs and chicken, and they have to make sure they are not deep frying these things, because the byproducts which is produced while deep frying the animal protein, it is very harmful for the disease and for the outcome of the disease. So we have to make sure and counsel them that either they are boiling it or they are steaming it. There has to be no deep frying of these animal products. And one non-vegetarian that they have to avoid is red meat. So lamb, goat. Okay, so they have to avoid mutton, they have to avoid red meat.
So Pushpa, why are patients not allowed to eat raw or undercooked food?
Okay, so when we talk about chemotherapy, the drugs in the chemotherapy which are used, they kind of reduce the immunity of the body. Okay, so we don't want to invite infection through food. Okay, so we have to make sure that we are properly cooking the food, and we have to make sure we are not eating anything raw. So by raw, what I mean is a lot of people have a habit of eating raw sprouts, thinking that it is more beneficial if they eat it raw. But the truth is, once the moong sprouts is cooked properly, or any kind of sprout is cooked properly, that time the nutrient absorption is the highest. So they have to cook that. And as far as salads are concerned, they can steam it or they can stir fry the salad and then eat it. But we have to make sure we are not inviting any infection through the food.
Patients also wonder that how can they plan meals in a way that they get their appropriate nutrition, and at the same time they can keep their nausea also to a minimum.
Okay. So as far as nausea is concerned, ginger and lemon works really well. Okay, so either they can go ahead with ginger tea and sip throughout the day, and they can use lemon on their food, and even they can go ahead with lemon water. So this will keep their nausea minimum. Of course, the side effects are inevitable. So, but these food can keep it at a minimum level. As far as planning a nutritious diet that will kind of support them throughout the treatment, it is very beneficial to seek a dietitian's advice on the same.